Hello, everyone, and welcome to the Don't Risk It podcast presented by VFIS Risk Control and Education. This program focuses on the exposures our clients frequently encounter and discusses some potential solutions to help reduce these exposures. I'm your host, Chris Rogers, and today we're discussing staff injury prevention in emergency services. Joining me on the program today is Ann Seaton. Ann is an injury prevention specialist with Penn Sports Medicine, and she is contracted with Lancaster EMS in Lancaster, Pennsylvania to assist in their staff wellness program. Ann is joining us to discuss how she leverages her expertise as an athletic trainer and applies these concepts to help prevent staff injuries and provide advice to employees who may have experienced an injury. Ann, I want to thank you for joining me today, and it's a pleasure to have you on the program.
Yeah, thanks for having me.
Absolutely. So, we often we hear the phrase athletic trainer, but there might be some misconception on actually what that means. So can you tell us a little bit about your background and how you became an athletic trainer?
Yeah, I became an athletic trainer because I was interested in sports and helping people get better and perform the best that they can once they're better. So I went to when I graduated, I only had to get an undergraduate degree. So I did my 4 years as undergraduate through Messiah College, and I became employed through a local physical therapy company, and I was contracted out to a high school. So you normally would see athletic trainers in athletics. So high school level, collegiate, professional sports is where you'll see an athletic trainer. So athletic trainers, you'll typically see us on I always say, like, when you're watching a football game and an athlete goes down, we're the person who goes out and helps them. So we determine severity of the situation. Do we need to call EMS? Do we need to just take them off the sidelines and evaluate their injuries? And then we can determine, are they able to return to play? So let's say they just sprained their ankle and it's something we evaluate. We don't think they need x-rays. We don't think they need a further evaluation. So we can return them to play. We can tape them. We'll do all of their rehab and help them return to their sport and be able to perform their sport healthy and the most injury-free that we can help them. So as athletic trainers, that is one aspect of what we do is injury, like rehabilitation, injury assessment. We also work on prevention. So a lot of times athletic trainers can help come up with ACL prevention programs, or we're the ones looking at the field and saying, like, this could be a hazard, or football's a good example because there's football equipment, and how can we make this a safer place for the athletes to perform. So that's where you would typically see an athletic trainer in the collegiate high school athletic setting.
It almost seems like we need to focus on Achilles now with all the injuries that are occurring in basketball. 25-year-old people that are blowing out Achilles, that's at an abnormal rate. So it's strange that that's happening.
Yeah, so athletic trainers were really good at prevention, so helping to see muscle imbalances or anything and help come up with a program to help tailored towards injury prevention.
So how did you leverage all those things that you learned and become employed and working with Lancaster EMS?
Yeah, so I had always been interested. I knew that public safety was a setting, and it wasn't, when I was in college, it wasn't a super big setting, mostly just traditional athletics. But I just had an interest in public safety. So when I became employed at a high school here in Lancaster, I had reached out to Jerry here at Lancaster EMS because I knew the importance of high schools connecting with their local EMS, establishing a good relationship. So Jerry and I had kept in contact over the years, just saying he came out to the high school and he toured and he, said, ambulance can come here and ambulance can't. Here's how you direct and here's what we need to know. So we just kept in touch. And then one year he reached out to me for National EMS Week because he had noted that here at Lancaster EMS, very consistently over the past 5 years, 43% of their workers' comp injuries were back injuries from improper moving and lifting. So he wanted to do something to help prevent that, help curb it, help the employees get better. So he had reached out to me initially because he said, hey, can you do a continuing education session for us on proper moving and lifting? So I took that opportunity and I said, yes, I can. Here's the thing. You could use an athletic trainer because we deal with a lot of musculoskeletal injuries, and you're talking musculoskeletal when you talk about back injuries. And we do a lot of assessments on athletes and their movements, and we have to know their specific positions and how to tailor a program to them. I can do that for EMS. It's musculoskeletal. The job is a lot of ergonomics, and as I'm finding out, it's way crazier than I even imagined. Some of the stuff that these EMTs and paramedics have to do, some of the situations they're put in, so you can't always properly move and lift someone when they're in a cramped bathtub and there's no room to move. But this is something that I have done. So I argued my case and I said, here's my skill set. I think it could work for you. So I did that continuing education for them for EMS week. And then I passed them along to my supervisors to negotiate a contract. And that's how they got me on board.
Well, it's certainly a unique setup. I don't think I've ever heard of it until having an athletic trainer in an EMS environment. So can you describe what a typical day would be at Lancaster EMS for what you do for the organization?
Yeah, there's no typical. I think
I guess when you're dealing with that, yeah. all the types of injuries that you mentioned, but try to narrow, try to give us a typical day.
Yes, so I can treat anyone who sustains a workers' comp injury or an injury that is off the clock, so something that happens not here at work. So a lot of times I will get referred someone. So if someone got hurt here at work, I will get their injury report forwarded to me. So I'll reach out to them and say, hey, I'm available for you to help. I can look at your injury. I can help you treat. I can refer you as appropriate. And they have that choice to come see me or not. And then if someone reaches out to me, I've had people who've sprained their ankles stepping off a deck. There was someone who had an open tib fib fracture playing basketball. So that's something that I go to people's doctor's appointments with them if they want me to help have another set of eyes and ears and to hear what the doctor's saying, and then just to help advocate for them in the doctor's office if they're ready to return to work, if they're not. And then I can do all of their rehab if they choose to come see me. So I will, if it's a typical injury like ankle sprain or a back injury, I just follow through with my normal treatment plan. And then what I'll usually do, and I incorporate a lot of functional activities because this job is not just, let's make your ankle better. A lot of times there's core stability, other things going on up the chain of the body that we can help correct as well. And so then what I'll do is once that person is ready to return to work, the doctor clears them, or if they didn't go to the doctor, they're ready to return to work, I will join them for a ride along a lot of times to watch them as they work and help give them just to make sure they feel comfortable returning to work and that they feel confident in their job. And then I can watch them and give them pointers and tips and tricks on how to maybe do something a little bit better so they don't have as much risk of injury. So that's one of the aspects that I have here at Lancaster EMS. The other aspect is I do some prevention stuff. So I will talk to all the new hires. I will go over all the equipment that's available to them because a lot of times EMS providers just have in their brain, oh, this is how I'm going to get someone out of the situation. And so I'll just review the equipment that's available to them. And I'll go over how to properly use that equipment and move and lift with it to help minimize the risk of injury. And then I'll share that with the new hires. I talk to the EMT Academy. I go over healthy habits with them, wellness, because this job is not a typical job. They're seeing things and long hours and long shifts and doing things that I didn't even realize as a non-EMS person. So different ways to help with their nutrition and sleep and just overall wellness. I talked to the EMT Academy about that. And then lastly, this month, I should say, I am helping with annual reviews. So we're reviewing all the equipment that's available. We're trialing some new equipment for them, see if it will help. And a lot of people actually like the new equipment we're trialing. So I'll just review the equipment, help them walk through scenarios. That's what I'm doing this month with annual reviews.
Well, what you're doing is probably also planting some seeds for some best practices on how to maneuver patients around, because if we're doing it outside of an emergency environment, it becomes a habit that we formed, and so it becomes second nature as opposed to it's skills that they might not have had before, and it puts them in a situation where they could get injured.
Yes, that's another thing too. I'll flag some people, or they'll come to me saying, hey, my moving and lifting skills aren't super great. So I will go out and assess them and help them correct those bad habits and help them work on doing things a little more efficiently and help them get stronger so they're able to do their job well.
Awesome. So can you tell me about the work injury study that you did with Lancaster EMS?
Sure. This sort of fell into my lap. I got connected with, Penn Med 1 is emergency room physicians through Penn Medicine who help run calls with the EMS provider. So I got connected with one of those doctors, and he was really interested in what I'm doing. And so I had I kept a spreadsheet of everyone that I have treated. So work-related, non-work-related injuries, ergonomic moving and lifting assessments. So we just went through that spreadsheet and we created this study just showing that having an athletic trainer can be beneficial to an EMS company. And so that's what we had put together, and we presented it at Penn Medicine's Emergency Medicine Day. I got connected with another, at the time he was a fellow, emergency medicine fellow. Now he's one of the directors of Penn Med 1.
So, I think you've kind of hit on this in several of your comments, but could we just sum it up in one question? What is your ultimate goal in serving Lancaster EMS?
Yeah, my biggest goal is to be able to help the EMS providers be able to do their job efficiently and effectively and do it as pain-free as possible is the first thing, because it's not any fun to be in pain and trying to do your job and focusing on others. And a lot of times these EMS providers are just stubborn and don't want to admit that things are hurting or are wrong. So my goal is to help them to be able to say, hey, I can help you with this. I can help you feel better. I can help you in your daily life, musculoskeletally. And then also there's other aspects of athletic training that I can help to mentally and physically.
So this is, as I mentioned before, this is something that we haven't seen from when we go out and do our surveys. I think there's less than 20, 25 of these types of programs across the country. Can you go into that and how this type of work could benefit other EMS organizations?
Yeah, I'm part of the Public Safety Athletic Trainer Society, and what from our knowledge and the data we've gathered is that there's 23 programs across the country in fire, police, or EMS. Now, some of them might have multiple athletic trainers. I know some of them are more built out. They have nutritionists who work in specifically first responder nutrition and sleep. So there's some programs, some are more fleshed out than others. Some are full-time, and I'm only part-time here. But this is a great service for any sort of fire, police, EMS, because this job is so physically and mentally demanding. And like I said earlier, a lot of times they're not going to seek help unless they necessarily have to, unless they're just forced to. They can't do their job anymore. They're in too much pain. So this is something, one, just on a practical level from an injury standpoint, to be able to help these providers and point them in the right direction and get them the care that they need, but also prevention. Prevention is a big key. And athletic trainers, that is one of the things we do really well. Because if I'm able to prevent an injury, that's one less person who has to go to the doctor, one less person who has to be held out of work, one less person who has to be filled their spot for overtime. So this is something that we can help with. The other thing is if people are not injured, they're usually happier with their job. And once again, they're more satisfied and able to do their job better. So as athletic trainers, we're just a puzzle piece in helping that come true.
With so few programs across the country, are there any resources that you're aware of that listeners could possibly go to if they're looking to maybe go down this road?
Yeah, there's the National Athletic Training Association website has a few resources. Like I said, I'm part of the Public Safety Athletic Trainers Society, and they have a lot of resources on their website for athletic trainers or for fire chiefs and police and EMS who can reach out and help us if they want get our help if they want to establish a program like this. So there is a lot of athletic trainers out there who are interested in this and would love to do something like this and help this different patient population. So the Public Safety Athletic Trainer Society has a really good website with resources that they can reach out to.
Okay, we'll be sure to include that website in the description so our listeners can get some more information about it. But Ann, I want to thank you for joining us today. It was a pleasure to chat with you, and it's certainly a unique program that taught us a lot today. And so I thank you for your time.
Thanks for having me.
And I want to thank you for listening to the program and for your interest in VFIS safety resources. I want to thank Ann once again for her time and information. Please consider subscribing to our program to stay up to date on new content releases. Also, if you like what you've heard, please consider leaving a review below. For more information about the many resources available from VFIS, please visit VFIS.com. And to submit ideas for future discussions, please reach out by email at VFISriskcontrol@VFIS.com. Thanks, everyone, and have a great day. The views, information, or opinions expressed during this program are solely those of the individuals involved and do not necessarily represent those of Gladfelter Insurance Group, VFIS, and its employees. Additionally, all views, information, or opinions expressed are provided for informational purposes only and should not be construed as legal, medical, or other professional advice on any subject matter.